Hey Miami Lakers, welcome to our daily COVID-19 update here on Facebook Live. We're going to do a question and answer session, so make sure you start submitting those questions now so we can get into them a little bit later. But one of the commitments that we made to you all is that we do it 7 days a week. And going forward, we're going to be inviting guests like Commissioner Esteban Bovo, who's here with us today, to give you guys an update in regards to Miami-Dade County's response, what they're doing at the 305 COVID-19 testing site, and a lot more information that's very pertinent. So the manager and I, every day of the week, we're gonna hopefully be inviting people, first responders, county commissioners, you name it. We're gonna bring these folks to make sure that you hear directly from them as to what's going on in our community. So today we're gonna do the Miami Lakes update real quick in English and Spanish, and we're gonna turn it over to our commissioner, who's gonna be talking to you guys, and then we'll get into the question and answer phase later on during the Facebook Live. So start submitting those questions now. Mr. Manager?
Yeah, thank you, Mr. Mayor. I wanted to start off by reminding everybody the number of cases that we have. As of this morning's report, the State Health Department is reporting 19 confirmed cases here in the town of Miami Lakes. That's an increase of 2 from yesterday. That's not too bad. We're still in that 0.5% of our population, which is incredible. And it's again, it's a testament to our residents that are taking seriously our social distancing measures and rigorous hand washing. And that's on you. Congratulations. Quería avisarle a todo el público que ahora en la ciudad de Miami Lakes tenemos 19 casos confirmados positivos. Es un aumento de 2 desde los números de ayer. Y es un incremento pequeño gracias a la habilidad de nosotros los residentes de mantenernos en grupos pequeños, tener la distancia necesaria de una persona a otra, poniéndonos la cobertura sobre la boca y también lavándonos las manos. Estaba viendo hoy I was looking today and seeing some projections for when is it going to peak in the state of Florida. Nationwide, obviously we have different time periods, right? It came in New York earlier than it did here in South Florida, and the peak in New York is probably going to be somewhere around the middle of April. Unfortunately for Florida, we're a couple of weeks behind New York in that, so we got started later, and our peak is going to be probably around the end of April. So everybody beware and continue your measures. Now, if we steer away from the measures that we've been taking, that peak is only going to get pushed further out. La parte de arriba de la curva en el estado de la Florida, la proyección es que va a ser a finales de abril. Eso es distinto a otras partes de la nación. En Nueva York probablemente va a ser a mediados de abril. En la Florida, la parte de arriba de la curva va a ser a finales de abril. Le quería recordar que la CDC dio unas recomendaciones de cuando todo el mundo esté afuera en el público, supermercados, gasolineras, restaurantes para recoger comida, que se mantengan la boca cerrada. Eso es no tanto para proteger las otras gente alrededor de nosotros, pero es para proteger las otras gente alrededor, no para protegernos nosotros. A reminder that the CDC came out with recommendations to make sure whenever you're out in public to have a facial covering. That facial covering doesn't have to be an N95 mask, which is the ones that we're trying to hold back and reserve for use by our healthcare workers. Yesterday, the Dade County Mayor, Carlos Jimenez, issued a few executive orders, and I wanted just to go over a couple of them for you so you understand what he did. A few days ago, he had closed adult daycares. Yesterday, he relaxed that a little bit and is allowing the adult daycares to go and deliver the services in the residences of their clients. So that was a change. Ayer, el alcalde Jiménez de Condado, hace unos días, él cerró los daycare para adultos. Lo que hizo ayer fue que va a dejar los daycares que lleven esos servicios a la casa de sus clientes. También él hizo una orden para que los hospitales obligatorios tienen que reportar diariamente 2 veces al día al condado cierta información. El número de cama, el número de cama de intensive care, los números de máquinas de respirar, el número de pacientes que son de coronavirus y los pacientes que se están mandando para casa. Mayor Jimenez also ordered that hospitals twice daily have to report certain information to the county so we can start evaluating that information. The information that he's asking them to report are the number of beds, the number of ICU beds, the beds that they can convert from regular beds to ICU beds, the number of ventilators, the number of COVID patients, and the number of COVID patients that they're able to discharge home. So I just wanted to remind everybody, please do your part, we'll do our part, but the most important thing is each of us take responsibility for continuing the rigorous hand washing, our social distancing, and make sure that we don't gather in large groups.
So thank you, Mr. Manager. And remember, start submitting your questions now so we can get to them. So now to our county commissioner who wants to make sure that he gets out the information directly to Miami Lakers in English and Spanish and answer any questions that you may have.
Well, thank you, Mayor, and thank you, Manager, for allowing me to be here and part of your Facebook Live. And this is great format so we could not only give everybody the information that they need, but also kind of collaborate. We know there are many of you that are heeding all the warnings and are staying at home and only going out for the essential things that you need. And we thank you. We thank you. At the beginning of this odyssey, we talked about personal responsibility. This was not going to work if we did not all take personal responsibility and practice the guidelines of the CDC, making sure we have our protective masks, making sure that we have the social distancing necessary. I remind all of us that this is a manual that we're all writing together. There's no manual for this. We've been prepared in the past for hurricanes because we knew when the hurricane was coming, when it would touch ground, when it would leave us, and then we could always react to it. This is unseen. And at all levels of government, federal, state, and local government, we are all basically working together to not only write the manual on how to best address this and keep everybody safe, but we're also learning. We're learning, and myself and the mayor, along with the manager, all we could do is pass information that's given to us by the healthcare experts. None of us are doctors. None of us are scientists. But what we are is folks that could try to pass that information and make sure that you get all the tools you need to keep yourself and your family safe. We've opened a site at Amelia Earhart Park, that site, and we've been asking folks to please call 305-COVID-19, 305-COVID-19 to make your appointment. We do ask those that are showing the symptoms, please make sure you call. And those that are not, please understand that we're trying to prioritize the folks that need the testing immediately. It makes no sense, quite honestly, if you think you might have it and you have an appointment, in a couple of days, when somebody that does have it needs an appointment right away. So we continue to collaborate with all our local partners to make sure that we're efficient as possible. I'll be on a call later today to just kind of calibrate the numbers that we're processing there. In the first 2 days, we had 458 folks come by and get tested. Our rate seems to be about 20% positive outcomes. If we take that positive outcome throughout our entire county, you can see the staggering numbers of people that can be positive. That's why the protective gear. That's why we follow the CDC. If you don't have symptoms and you're a carrier, you're protecting others by following the rules. So again, Mayor and Manager, thank you for what you're doing. Thank you for keeping your residents informed, allowing me to participate. And for those that are watching, during the week at 1 o'clock every day, we host a Facebook Live on my page just to update everybody on the latest numbers that we have, any of the federal information that's flowing due, helping businesses, helping those that have lost their jobs. And we preach a lot of patience. We're all going through a very difficult time together, but we're going to be a better community after this. I have no doubt in my mind. Thank you, Mayor.
Comisionado, quiere ser parte de eso en español, porque yo sé hay muchas personas que están mirando el Facebook Live hoy que hablan nada más que español, y parte de la misión de nosotros para estar seguro que la comunidad entera sepa lo que está pasando.
Claro, gracias alcalde y al manager por la oportunidad de venir aquí a compartir con ustedes hoy. Quiero felicitar a muchas de las personas que están viendo esta transmisión, que no solamente están acudiendo las reglas, los informes que le estamos compartiendo, todo ello para que se mantengan seguros, pero lo están practicando y eso es sumamente importante porque a largo plazo nosotros podemos compartir información con ustedes, pero cada uno de nosotros tenemos que actuar en una forma responsable. Las mascaritas, los guantes, cuando vamos a salir, mantener ese distanciamiento social es sumamente importante para protegernos uno al otro. Es la única manera que podemos funcionar en este momento. Tenemos la ubicación en el Parque Amelia para que las personas que quieran tomarse la prueba del COVID-19, por favor pueden llamar al 305-COVID-19, 305-COVID-19. Hoy estamos cerrados, pero mañana volvemos a empezar a hacer procesos de las pruebas. En esta corta semana, no me han dado los números de ayer todavía, pero los primeros 2 días eran 458 personas que se le habían hecho la prueba. Hay un 20% que está saliendo positivo. Y esa es la parte alarmante. Si cogemos esos 20% y lo proyectamos en nuestro condado, sabemos que ese número puede ser altísimo a nivel condal. Tenemos que seguir practicando las reglas de la CDC, pero por vista, un domingo como hoy, un día donde estamos celebrando el Día de Palmas en nuestros católicos, vemos que las calles están vacías básicamente. Quiere decir que hay muchas personas cumpliendo con las instrucciones y las órdenes. Y les recuerdo a todo el mundo que yo entre semana a la 1 de la tarde, todos los días, hacemos un Facebook Live igualito donde también compartimos información del condado, del gobierno federal, el gobierno estatal. Y una vez más, les doy las gracias a todas las personas que están cooperando, trabajando juntos. Nosotros vamos a ser una mejor comunidad, sin duda ninguna, después de este proceso. Vamos a seguir ayudándonos uno al otro y puedes contar conmigo, con el alcalde, con nuestras funciones, asegurar que esas personas que están en su casa, que no pueden salir, personas mayores, aquí estamos nosotros para poder darle todo el aporte y la ayuda que podemos.
Gracias, Comisionado, and thank you, Commissioner. I know the Commissioner was the lead on getting the COVID-19 site done at Amelia Earhart Park. I mean, he worked very hard on that. I would talk to him all the time. He's like, hey, we're going to get something done for the entire Northwest State sector, and he got it done. So thank you very much for doing that for our community. I do see some questions. Make sure you start asking those questions. I'm going to make sure we start reading them out right now. I see the first one from Patricia Gormley. She asked 2 questions, and Mr. Manager, Mr. Commissioner, whichever one of you guys wants to jump in and answer it. Are the affected individuals, I'm guessing they're asking about the 19 folks here at Miami Lakes, are the affected individuals in hospitals or are they isolated in homes?
Yeah, the information that we get from the state of Florida is limited. Obviously, there's a lot of privacy issues involved in that, but the information that we get from the state of Florida for our town, for our city, is only the number. We don't know if they're severe cases, mild cases, if they're elderly residents, if they're young people, men or women. You know, they don't give us that type of information. So they don't tell us whether they're isolating at home or if they're hospitalized.
Mr. Commissioner, have you heard any of that type of information in regards to Dade County, or that's all?
Yeah, we need to remind ourselves that we are governed by certain laws. HIPAA laws prohibit us to have information of who's actually gotten a positive test. So it's very difficult for us to be able to pinpoint from that standpoint. I think the manager described it perfectly, depending on how the severity of your conditions are. If you're hospitalized, we pray for you. If they sent you home to basically quarantine yourself, well, we've seen instances of that already where folks have been able to do that without any problems whatsoever. And this is the unknown about this disease, the severity of the disease. But those that have tested positive, it will be very difficult for us to be able to, unless the family shares that information, we could maybe get some general statistics. And I will this week look to see if I can get better information on hospitalization from zip codes that might be able to give us a better indication.
So, para muchas personas que hablan español, la pregunta era si hay más información sobre las personas que tienen el coronavirus aquí en la ciudad de Miami Lakes. Y para acordarlo, para estar seguro que todo el mundo sepa, hay muchas leyes federales, específicamente HIPAA, que prohíbe mucha información saliendo. Pero para que sepan también, el Departamento de Salud está vigilando esas situaciones. So, el comisionado va a trabajar sobre ver si hay más información, pero global, sobre los zip codes aquí en nuestra comunidad. Pero vamos a ir hacia adelante porque tienen que tener su privacidad también protegido por la ley federal. The second part of Patricia's question, and I think it was answered with what you guys just said. Has there been tracking to determine who they might have come in contact with to determine if they need to take protective measures? And I'm guessing, I know that's part of the job that the Florida Health Department does.
Yeah.
They follow up, el Departamento de Salud. Si alguien que lo tiene, el Departamento de Salud empieza una investigación para ver quién son las personas que estaban ahí, hablan con ellos, para estar seguro que sepan el nexus entero de todo el mundo que puede estar en contacto con esa persona.
Claro, y alcalde, a veces cuando uno llama al 305 COVID-19, la información que parte, que lo que le preguntan es si ha estado uno en contacto con alguien que ha sido positivo. So part of, I think, the protocol that we have with the 305 COVID-19 number is ask a question, have you come in contact with somebody that has tested positive? Because this is part of our, kind of connecting the dots and degrees of separations among the people that have it.
Patricia, I hope that answered your questions. Let me check if there are any other questions. So Paola Les Borges, and I think you've talked about it, Commissioners. What is our closest testing center that is not only for people over 65?
Okay, so it's and I'm glad you asked that question. And I said earlier, there's a manual that's being written, Paola, over and over again, and we're learning. This is almost like building the airplane while we're in the air. And originally, we started talking because the CDC had told us the ones that are most at risk are 65 and older. So all of our information was kind of geared toward them to keep them safe. But we're realizing now that this disease does not discriminate. Doesn't do it on age, doesn't do it on race, doesn't care what political philosophy you are, doesn't care if you're a man or a woman. So at the Hialeah site, what we've decided to do was modify our protocols, and they've done that also at the city of Miami, at the Marlin site. So you do not have to be 65 years or older. Now the requirement is you need to show the symptoms, and that's critical again. Just because you coughed once doesn't mean you have the symptoms. But if you come in contact with somebody, you have the shortness of breath, you have the high fever, then that dry cough, then we do ask you to please then call the number and set up your appointment. But we've modified our rules, I think county-wide now, not to only make it about first responders at 65 and up. Now we're making it anyone that has the symptoms. So if you know somebody that has the symptoms, please make sure they call.
305 COVID-19 en la society. Para las personas que están mirando en español, han cambiado parte de las leyes, las regulaciones, que ahora tú no tienes que tener nada más que 65 años, pero si tienen los síntomas pueden llamar al 305 COVID-19 y pueden tomarse el examen, pero si tienen los síntomas. Muchas personas no tienen síntomas y están yendo para allá. So what are the regulations for folks that don't have symptoms but are concerned?
Mayor and Commissioner, really the best advice that I can give anybody, if you're unsure, like the Commissioner said, none of us are medical doctors, nurses. So if you are at home, you're feeling certain things and you are unsure, the best source of information that you have is your private doctor, your family doctor. Call your doctor, tell them, Doc, this is what I'm feeling like this, like that. And that doctor will give you the best advice possible and direct you whether you should take that next step and call and seek out a test at the county sites that the Commissioner was explaining about.
So that's 305 COVID-19.
268-4319, 305-268-4319.
So we have a question, and we can all answer it because you can answer from the county side and from the town side. Michael Sanchez is asking, will building and zoning open this Friday?
Building and zoning, as you know, over a week ago, we transitioned Miami Lakes Town Hall to a virtual town hall. We're accomplishing 90% of everything that we normally do. The department that is suffering the most because it does have the most face-to-face contact with our residents is our building department. So the building department is closed through the end of this upcoming week. We are already looking at, first of all, asking ourselves the question, are we ready to reopen? And if not, if we need to extend our virtual town hall, what are the things that we can do in building to start opening up the spigot a little bit? Start opening up and being able to do and provide certain services remotely and electronically so that at least we can get some things moving within the construction industry here in the town of Miami Lakes.
So there's just to follow up on that, this past, we had a council meeting on Zoom. One of the things that we talked to the city manager about and we directed the staff was to follow what some other cities are doing throughout the nation. There are cities already doing remote plan reviews using Skype and Zoom. Believe it or not, there are even cities utilizing Zoom and Skype to do certain inspections, which is interesting, and it's very forward thinking. I think in this moment it's something we got to look at. So I know the manager's already doing his due diligence, contacting those cities, seeing what the regulatory side is to make sure that we keep moving forward, because we can't stall those types of investments here in our community, because that'll have a huge impact going forward. But from the county side, Mr. Commissioner, what's going on with building and zoning over there in the county?
Well, for us, unfortunately, we had individuals that tested positive, and so we had to literally close the entire facility. The PIC had to close up. No, at this point when we will open up. I know that we had a crew in there to completely clean, but I think what I find interesting is one of the lessons learned, I think, of the virus is that how much we do with technology, how much we can continue our processes and our practices through technology. And for a long time in the construction industry, one of the biggest complaints was the delay in applications getting processed, because it had its bureaucratic trail that it had to go through. Ironically, because of what has happened with the virus, it's forced a lot of us to conduct our meetings and our processes in different formats, and obviously Zoom and the computers and the virtual submission of your plans are changing that dynamic. I would say that we're going to see a lot more of that in the future. After the virus, there's going to see some lessons learned here that we may be able to apply in the future that'll make ourselves much more efficient. And it does remind me, while we have not closed the construction industry in South Florida, and I've had numerous conversations with the mayor, the importance of the construction industry in our community, the jobs it creates, and I represent here in District 13 numerous residents that basically live off the construction industry, from contractors to laborers. We continue to ask those job sites to practice the social distancing, submit your safety plans, but understand, if they're being violated, we will shut down construction sites.
So, como vieron, están trabajando con los departamentos desde el condado y la ciudad de Miami Lakes de building y zonificación, para estar seguro que la industria, los permisos de su casa, los permisos de diferentes cosas siguen moviéndose adelante. Vamos a usar tecnología en los diferentes departamentos para seguir estos procesos yendo hacia adelante hasta que se termine este problema del coronavirus. Let me see, Michael, I hope that answers your question. Christina is asking, okay. Lisbeth Gutierrez, and I think we just talked about it now, she's asking also, when is your permit department opening up again? Thanks for, obviously there's a lot of interest there, there's a lot of people waiting. Mr. Manager, I know you talked about it, I don't know if you want to just say, repeat that, she just asked the question right now. Lisbeth.
Yeah, initially we closed everything because we were going to do it for a 2-week period, and the cost benefit of revamping all of our processes for a 2-week period didn't make sense. But this week coming up, internally, me and my executive staff, we're going to be making hard decisions on whether we are ready yet at the end of this next coming week to transition back from a virtual town hall to a regular town hall. All indications are that may very well need to be extended. And with that extension, we're going to be, since it is going to go past the original 2 weeks, we're going to look and see what are the things, the processes, the workflows in the building department that we can now start to redo and maybe do them remotely, electronically, and we're going to start looking at that. And I suspect that by midweek we'll be announcing what processes we are going to be able to do starting the following week, starting the 13th of April.
Yeah, I think Mike followed up with his, and you could see the need that there is to restart some of these things. He needs inspections before it starts raining because he believes that it'll break his pool excavations. We got to help people, and rest assured, the manager, our county commissioner, everybody's working to make sure that we start doing some of those things ASAP to make sure that, especially those types of permits, that we keep moving forward.
Now, since the beginning, as far as inspections go, we have always, from the beginning, our building official understood the difficulty of not having inspections. So he has allowed, since last Monday, he has allowed inspections to be done with certifications. And what that means is the contractor gets a licensed professional who is certified to do the inspections and could certify that the job is being done according to code, and you can submit that to our building official in lieu of having a town inspector inspect the project. That way, the projects can continue to move forward.
Got it. So that's a great alternative. Elia, hablamos ahorita mismo que hay 19 personas aquí en nuestra comunidad, en la ciudad de Miami Lakes, que tienen el coronavirus, pero tenemos que seguir trabajando para estar seguro que ese número no crece mucho más. So, muchos de los residentes están haciendo un buen trabajo sobre eso. So, but just repeating myself, there's 19 cases here in the town of Miami Lakes. There is a good question. Lydia Correa, she is asking, will senior citizens continue to receive assistance with the groceries delivery in the upcoming weeks? I don't know if you want to touch upon that, Mr.
Well, let's a couple of things to remind ourselves. If you call 311, if you're a senior in our community, you call 311, you will be put on a list. You won't have to call again, and you're being provided food. Since March 17th, we have provided over 3,000 meals to seniors in our community. In adjacent to that, I have been collaborating with Mayor Manny Cid here now for the last 2 Fridays in a row, where we have helped those most critically needed in our community, 65 and over, 70 and over, that we're precisely asking them not to go out. And we understand they need help. If we ask them not to go out because they could be vulnerable because of pre-existing conditions, although now we've seen a lot of the data showing that young people also should be taking more precautions than maybe they should have at the beginning. But if you're a senior in our community, rest assured, if you call our offices, we will put you on a list. We will put you in direct contact with those that are providing services. Mayor, we've been so thankful with Farm Share, supermarkets that have stepped up, a lot of providers that have stepped up, have given us their bounty to make sure that we could pass it out to residents in our community. I personally have been to buildings where we're practicing the safe distancing so that we don't put anybody in harm's way, not ourselves, not the people we're trying to help, by placing it at their door. And it's been, one of the reasons I got into public service was precisely for these kind of moments, for us to be able to help our community. And I've been profoundly touched at the level of neighbor helping neighbor in our community. Nothing says more about a community when it is tested like we're being tested right now. And to see folks willing to put themselves in harm's way to go out and help. Yesterday in the city of Miami, same thing, Farm Share with Commissioner Manolo Reyes, passing out food to folks in their cars. You see the need in our community, number one, and number two, the volume of volunteers that come out and want to help. And it is a very heartwarming, y bien breve en español, las personas que mayores en nuestra comunidad pueden llamar al 311 para que los pongan en la lista de personas que están recibiendo alimentos. Desde el día 17 de marzo hasta ahora, más de 300,000 comidas han repartido personas mayores en nuestra comunidad. Por favor, llamen al 311 para que los incluyan en esas listas y no van a tener que llamar todos los días, una vez solamente, y los ponen en la lista. He participado con el alcalde Manny Cid ya los últimos 2 viernes consecutivos, asegurando que personas en nuestra comunidad tengan los alimentos necesarios. Y le quiero felicitar a Farm Share, a muchas personas que han donado comida precisamente para ayudar a esas personas que sabemos que tienen que quedarse en su casa. Y es de mucho orgullo en nuestra comunidad ver cómo uno se reúne en estos momentos tan difíciles y ayuda. Y lo estoy viendo por todas partes de la comunidad. Ayer también tuve el honor de poder participar con el comisionado Manolo Reyes, lo mismo, repartiendo comida a las personas, practicando ese distanciamiento social, pero quizá más importante que nada, cuántos voluntarios, gente joven saliendo para poder ayudar. Y habla bien de nuestra comunidad, que cuando hay un momento difícil, todo el mundo pone todo al lado y se ayuda uno al otro. Eso es vecino ayudando a vecinos. Y para mí, alcalde, es quizá una de las cosas bonitas de lo que estamos viendo durante esta tragedia.
No, the commissioner is absolutely right. We have to continue seeing unity. The community's coming together like never before. So I really am proud of that, to see all the residents coming together, que todo el mundo viene junto y la unidad para ver eso. Pero estoy seguro que trabajando juntos, siguiendo trabajando juntos, vamos a superar este problema. Christina Duvasova is asking, can healthcare workers make reservations in our supermarkets in Miami Lakes, as our hours are so different now with the COVID-19 pandemic?
The one thing that the Publix did is they implemented a certain time slot for seniors. I will bring up that idea to the local supermarkets here in the town of Miami Lakes, because maybe they can do something. Sometimes they get all this that it has to be at the corporate level, but I think we've been working in great partnerships with the local management of the local stores here, and we'll bring that up to them and see if we can get a specific time slot for the frontline people to be able to go and take care of their necessities.
That's fantastic. And if I could add something, one of the unknown stories perhaps in our community is the convenience stores, the smaller supermarkets in our community. They have supplies, they're fully stocked. We encourage folks to perhaps visit some of those locations. But I do want to acknowledge our frontline healthcare workers, the nurses, the doctors at our hospitals that are literally in harm's way. We've seen nurses pass away. We've seen doctors in critical situations that some pass away. Police officers, firefighters. It is unbelievable and a testament to them that during this most critical time, as sometimes I know as a former firefighter, you know, the DNA of running to the fire when the rest of us run away from the fire. Here are these folks that are literally hands-on with our community. It would be well advised, and I'm going to make a mention to our mayor also, that perhaps supermarkets can have separate hours set aside for healthcare professionals that are in the front line. And I would be remiss if I did not say that today, Mayor, we're going to be issuing a letter to the governor. You know, part of the problem that's going on with Jackson right now is that the burden on the hospital has been intense. And the CEO of the hospital, who's done a fantastic job leading that hospital from a red situation to totally in the black, is contemplating having to make some furloughs to non-essential personnel. But I would submit that everybody in the hospital right now is essential. Everybody. Everybody's intertwined and linked to each other. And we're asking the governor, while we expect federal help will be coming later in the month, what we'd like to avoid is having furloughs now. And if the governor and Representative Speaker Oliva, the Senate President Galvano could intervene now, they're going to have to go back and revisit their budgets. All of us are going to be revisiting our budgets probably in the next couple of weeks to be able to address this. But to me, if we could hold them harmless, if we could keep them financially sound during this period, it not only gives us peace of mind in our community, but also helps with a lot of those healthcare workers. And like I said, while it's not nurses and doctors that they're talking about, if you've worked at a hospital, everything is intertwined to each other, everything. So we would ask that the governor intervene, help keep Jackson harmless, our safety net hospital, to support all those frontline folks that are there.
Well, thank you for that. That's so important. I think that's so important. I mean, talk about it in Spanish real quick about Jackson. Yeah. I think it's really important.
Creo que, y la pregunta era si se le podía, primero que nada, abrir los supermercados para las personas que trabajan en los hospitales diferentes horas, porque tienen horas especiales. El manager de la ciudad se compromete a hablar con los supermercados aquí, las administraciones. Yo se lo voy a mencionar al alcalde Jiménez. Yo creo que sería buena idea que se abriera para esas personas. Pero quería un paréntesis, hablar y reconocer esas enfermeras, enfermeros, doctores, policías, bomberos. Son las personas que quizás más peligros corren en esta situación. Ya hemos visto enfermeras fallecer, policías fallecer, vemos personas que están enfermas críticamente porque precisamente están trabajando con personas que están positivos constantemente. Recientemente el director del Jackson Hospital, el señor Migoya, que ha hecho un trabajo fenomenal, y yo soy no solamente admirante de su trabajo, pero también amigo de él, está contemplando tener que despedir temporalmente o darle, en inglés furlough, no sé cuál es la palabra en español, pero básicamente darle días libres a empleados sin pagarle. Y es una decisión que sabemos que es sumamente crítica para esas personas que trabajan en el hospital. Y hoy estamos preparando una carta que va enviada al gobernador de Santis con copia al presidente del Senado y de la Cámara, que es nuestro representante José Oliva, para que trabaje con los presupuestos para asegurarse que estos hospitales no tengan que despedir, no tengan que mandar a alguien para la casa sin pago en ningún caso. Y aunque además que se contempla para enfermeras y doctores en este momento protegerlos a ellos y los demás no, yo te diría, como una persona que ha trabajado en un hospital, cada empleado en ese hospital está conectado uno al otro. Hay aporte que se le da a esas enfermeras y esos médicos que vienen de personas que posiblemente no sean enfermeros, que no sean doctores, pero son críticos para la misión que están haciendo. Entonces nuestra carta va a ser para pedirle a nuestro gobernador que intervenga, trabaje en este momento para que no haya ningunos cortes al hospital, mientras que la ayuda federal que viene, y va a venir esa ayuda federal, venga, que mantenga ese hospital en la función que está haciendo ahora, que es bastante crítica.
Gracias, comisionado. Y también we have Jessie Leiva, who is a town employee. She is the liaison for our Special Needs Advisory Board. And just to reiterate, if anyone has a disability or family member with disability special needs in the town of Miami Lakes, reach out to her. She's a great resource. She's going to put you in direct contact with many different resources in our community. Send her an email. It's in the comment section of this Facebook Live.
She does great work.
Definitely. Let me see if we have any other questions. So I don't see any other questions. I do want to end up closing out this Facebook Live and thanking the commissioner for coming out today. You guys hearing directly from him. He represents the entire town of Miami Lakes, all of Northwest Dade, and specifically he got the Amelia Earhart Park site, the 305 COVID-19 site done. He was working on this for several weeks, so I really wanted to thank him for that, for getting that done. Do you guys have anything else to say before we close out the Facebook Live?
No, I just want to, my final word is a reminder, and I said it earlier, is each of us as individuals, I mean, we always look to government to help us, and I think all levels of government are doing an incredible job in this fight, especially with the unknown, right? As the commissioner was saying, we're writing the book now. This is something that we've never had. It was over a century ago, the last time that we had anything that even resembled this. But each and every one of us as individuals can do our part, which is with the rigorous hand washing, making sure that we cover our faces if we're out in public, and make sure that we're maintaining that social distancing and only gathering in very small groups.
Y creo que, alcalde, lo único que pudiera añadir es que esta semana entramos ahora en Semana Santa, y para muchos de nosotros que normalmente podemos acudir a las iglesias, que no tenemos esa oportunidad, vamos a recordarnos que la iglesia es entre todos nosotros somos la iglesia, y esta semana te diría que va a ser una semana bastante crucial para nuestra comunidad. Vamos a ayudarnos uno al otro, vamos a velar y vamos a rezar. Es importante que tomamos tiempo para rezar para nuestra comunidad. Estoy convencido que vamos a ser una mejor ciudad cuando todo esto se termine. And just briefly in English, Mayor, we go into Holy Week now. While we can't go to church, I would submit to you that we are the church, each and every one of us that are practicing Catholics. And for those that are not practicing religiously, I would say that now's the time for prayer. Prayer for our community, prayer for those that work on a daily basis with those that are sick, those nurses, those doctors, those firefighters, police officers, all those frontline folks. Now's the time to pray. I know we're going to become a better community out of this. And God bless and thank you. Thank you both for allowing me to be here with you today.
God bless you all, and remember, unity. That's what we need in our country. That's what we needed during this issue in the state, in our county, in our cities throughout the United States. And together, we will get through this. God bless you and take care.